Well, welcome to the Aging Boomers. I'm your host, Frank Sampson, and the Aging Boomers is a show that we discuss many of the issues facing, of course, boomers today and an aging population. And we're thrilled that you joined us. It's show number 6, so hopefully number 6 of many more to come. And I'm really excited about today's show because not only do I have a wonderful person who has given so much to the elder care community, but she's also a good friend and kind of knows quite a bit what I'm doing here because she's had her own radio show. And so Kira, we have Kira Reginato. Hi, Kira.
Hi, Frank. Thanks for having me on.
Oh, it's a pleasure. It's great. So just a quick intro. Kira is Director of Business Development for Creative Counseling. She has been an elder care manager and also serves seniors and their families in a variety of settings, including skilled nursing facilities, residential care homes, hospice, and Alzheimer's Adult Health Center, and Meals on Wheels program. Kira holds a degree in public administration and gerontology from San Francisco State University. And again, thrilled to have you on, Kira. Thanks so much for joining us on the Aging Boomers.
Well, you are welcome. You know, you and I are helping families every single day because people are so lost when it comes to knowing how to find the right resources to help a loved one. And they don't necessarily have to be elderly, right? We can have things happen to us when we're younger, and people are just thrown into this other planet, and they have no resources. So I'm always excited to talk with people because I feel like if they start with an elder care manager, which is what I am and what our firm does is elder care manager or elder care consulting, that they can begin to get a plan in place and not spend hours on the internet themselves or talking to people who don't do this for a living. You know, I can talk to you all day about my car, but are you really going to be able to diagnose why the engine light's on, or should I just take it to the darn garage and have them tell me, right?
Yeah, absolutely. Well, it was me. You take it to the garage, no doubt about it. So I do want to talk about elder care management, but I love for you to tell our listeners more about, tell us about creative counseling and what you're doing there.
Well, creative counseling was started by Drew Ross, who's a marriage and family therapist, and he realized that what he wanted to do was take his knowledge and schooling about messy family dynamics and people who had mental health illness and people who had personality disorders and begin to help them and their families put together a plan and have a system of care and support, because so often those populations don't know where to go for help. So he took his schooling and created this method of therapeutic care management where we're really looking at holding the whole family when something's going on. Because, you know, I mentioned to you actually off air that I'm caregiver now a little bit to my father who's ill. And, you know, if Drew were working with me, he would be advising my dad, but then he'd also be working to support me because so much is going on with the adult children when their parents are declining cognitively or physically. So my job right now with him is actually to go out in the world and tell people what our firm does and get them excited to use an elder care manager sort of no matter where they live as a really good place to start to get their questions answered and to begin to formulate a real plan, not just stopping by and mentioning something to your dad and having him go, I don't need that. Get out of here.
Right. Well, you're a perfect person to do that, and I know you're going to do well. So, I mean, you've been an elder care manager. There's a lot of different terms. So maybe explain, there's elder care manager, geriatric care manager. I mean, are these all synonymous, or are there really differences?
Yeah. Well, when I started out, we called it geriatric care management. That was about 15, 20 years ago. And geriatric is meaning old people, and pediatric means the kids. Geri and pedi were the Latin prefixes there. So everybody knew what pediatrics was and what a pediatrician did, but nobody knew what geriatrics or a geriatrician was. And to tell you the truth, we don't really have people coming out of med school in the numbers we need to serve older adults. It's a huge problem right now to find a physician who's sort of primary care but specializes in working with problems of older adults, because we've never had this many older adults to deal with, right?
Yeah, true. Truly is a silver tsunami, huh?
A silver tsunami, exactly. So that's what we called it. But if I said that at a cocktail party, that I was a geriatric care manager, people would walk away from me. They wouldn't know what the heck I did. They'd smile politely and leave. But if I said, well, I work with people who have aging parents, well, suddenly there was a conversation to be had. So geriatric care managers, elder care managers, to me are synonyms. And I just now say, too, elder care consulting, because people get that you're consulting with them about how to handle an older adult, and that makes more intuitive sense to them.
Great. So I know there were some things I know you wanted to cover before we went on the air.
Yeah.
Why don't you go ahead and explain some of what you want to share?
Thanks. When I deal with, people call our office every day looking for, they'll call and say, I don't really know what you do, but here's the situation going on in my household. And experts always recommend that people have a conversation with their parents sort of earlier than later. They call it the 40-70 at home instead, right? When you're 40, you should be sitting down with your 70-year-old.
Right.
Or if your 40-year-old doesn't want to talk about it, that's too bad. If you're 70, you take the initiative and say, listen, this is what I want as I age, or what I want, quote unquote, as I get older. Not necessarily for when you die, but you're certainly looking at, what am I going to do from 70 to 90? What are my wishes? But people put off those conversations on both sides for a variety of reasons. And I figure if people don't want to have those conversations, that's the perfect time to call in an elder care manager, because we have different backgrounds. Some people are nurses who come to the work. Some are gerontologists. Some are social workers, some are marriage and family therapists, but somewhere along the line, people have had training dealing with having these conversations and dealing with family members, and we can ask the hard questions, and we can have the hard conversations and sort of preserve the familial relationships. If you don't want to ask your dad why he's not bathing and why he smells like urine, let me ask that, right?
Mm-hmm. Right.
And one person removed, and it's a heck of a lot easier to have it asked by a professional than it is by the kid, and yet the kid's on the front lines noticing it or noticing what's going on in the household, but they don't know how to get somebody in there to start affecting any change. And what I like to say is that when a family gives us a call and we enter the picture, parents know that the family is up the ante into now being a serious situation that does need to be discussed, and that movement is now required. And it's not only on the older adult side, it might be on the kid side, because we're putting a plan in place. So, for instance, groceries need to get picked up, and so do medications and doctor appointments. Let's say there are 3 children. 2 of them live nearby. Typically, the only person doing much is the oldest adult daughter.
Right.
But if there are other siblings, my job as a care manager is to try and marshal the strength of each of the sibs, regardless of where they live, and try to get them to take a piece of the care plan that we design so that it's not all falling on one person.
Yeah. It's tough. It's tough enough to get families to talk, like you said. I know that you, on your show and throughout the community, express to families that they need to have these type of discussions, and I do the same. But how do you get them to agree to hire a care manager, an elder care manager, when it's tough to even get them to talk to one another?
Yeah, that's a really good question. Most of the time we ask for just for someone to give us a call to start the ball rolling and to allow that first meeting to happen. Because I think the people who, I'm just going to say, let's identify like the mom, the older mom, she has a lot to say, and she's afraid that if somebody's hired, they're going to come in and quote unquote tell her what to do. And I don't know about you, but I don't want anybody to tell me what to do. I don't care what age you are. And so when we explain that we're not here to tell anybody what to do so much as we are to go in and have a professional assessment of what's going on and offer some solutions based on what that older adult tells us that they want. We ask them, what do you want? What are your goals? And even if they have cognitive decline, dementia, memory loss, confusion, a lot of times really valuable nuggets will come out of that. Like, I had a woman say to me, I just want my children, the two daughters that were bickering, to get along before I die.
Right.
And it's very poignant, you know. She didn't want a fancy retirement home. She didn't want, the house vacuumed 3 times a day. She basically just wanted her 2 kids to go. And I had another woman say to me that she wasn't going to go until her kids all made peace with each other. So she was kind of hanging out. That was what was important to her. Mm-hmm. Other people have, care needs for their husband that they want addressed, or, they can be many, many goals that they want. But my job as a good care manager is to really listen, see what my professional opinion is, listen to what the children are saying, and marry all of those opinions together to come up with some practical, cost-effective solutions.
I would
think... And I think it's money, really well spent. It doesn't take me 3 years. It can take me, 2 hours to put that together.
There's challenges in any type of professional role, and being an elder care manager, I know it has its challenges, but I got to believe probably one of the toughest things is, when that family doesn't plan, something happens. A fall, whatever, dementia sets in pretty severely, and then you get the call.
Yeah.
Okay.
Those
are the tough ones, right?
Sorry?
I'm saying those are the tough ones.
And yet that's the bulk of our callers.
Right.
Most people, I guess it's human nature, wait till a crisis happens, and then they are motivated to act. And we're okay with that. We know that that's true. However, as therapeutic care managers, we want to try to get underneath the problem once the crisis is addressed. We don't just want to put a Band-Aid on it and forget it. We want to actually get underneath, look at it a little more in depth, and put some systems in place to prevent ongoing chasing of our tail, which is what we see most families do. They are doing ER visit after ER visit after ER visit, rather than having us come in, sit down, figure out what the causes are, what the remedies are, and sort of stop that round and round admission cycle, as one example.
Right. And I would also think that having a third party come in, especially someone very knowledgeable in the field, maybe the parents and even the children will maybe listen, be a little more open-minded than them trying to convince one another that something needs to be done.
Absolutely. And I think a lot of that is because the siblings are often not all on the same page. My sister and brother are right now in another state from my dad, so I'm doing the day-to-day caregiving. He's calling them. Maybe what he's reporting to them is a rosier picture or a less rosy picture than what I'm seeing. Even if he interprets it that way, it may be not factual, but it's what he feels and what he relates, or maybe he doesn't want to worry them, or maybe he wants to worry them more. So if you were to get all 3 of us on the phone, you might get 3 different pictures of what he's going through. My job as a care manager is to have that conference call with all the kids on the line to hear what picture they're getting from dear old dad, and then I go visit him, and I'm able to, after 15, 20 years, get the best, not the best, what do I want to say, the most accurate picture and be able to either reassure those siblings or set them straight. That, you know what, your dad's painting a much rosier picture than what's going on, and the sister who's visiting has got the right info. And we do need to plan for some safety in his home, or meals to be delivered, or, he can't drive himself to the doctor anymore. I can have those conversations with the family once I go in and assess what's going on.
I'm curious, aside from, like you mentioned, about the name itself, maybe there's been kind of changes through the years on what you call this profession. What else have you noticed has changed since you started doing this?
Well, I think there are more people doing it, but we're still at the point where there's not necessarily a national standard. So right. I think more people are doing it that call themselves care managers but don't necessarily have the underpinnings that they might need to have. I've seen that. I think that you need to know that as a consumer that you can shop around for different care managers, and I think that that's nice with having more now than there ever were before. When I started out, it was sort of like you had Jewish Children and Family Services and Catholic Charities, sort of major institutions providing care management, and now there are a lot of private practitioners that do it and do a really good job. And the scope of service that an individual private care manager can offer, which is, relatively new in the field, maybe the last 10 years or so, is usually much more expansive. After hours, weekends. I mean, there's many times that I'm bedside with a client in the emergency room, either until the daughter or son gets there, wife gets there, or letting the family member be the family member and minister to their loved one, but let me interface with the medical staff, and, sort of let them preserve that role and not be worried about being the advocate and the wife, let's say.
Right. So give our listeners just some suggestions. I mean, if our listeners are fortunate enough to be here in Northern California, they got Kira to call. But all right. But if they're not, what do you think steps they should take to make sure that they're dealing with the right type of individual? I mean, you check references. I mean, what would you recommend if someone called you in another part of the country and said, I'm looking for an elder care manager, I think
right.
This is what we need, what do I do?
The thing that I suggest, there is a national website for care managers. They can join this association. There are certainly many practitioners who don't join, but a good place to start would be caremanager.org. That's a website. You actually put in the zip code of where you or your loved one lives, and then you get information about the credentials, schooling, and experience in areas of practice that the person takes part in. So www.caremanager.org can be a good place. However, what I would suggest is if you don't live in some remote place in Montana, you'll probably get several people you can call. Go ahead and call 2 or 3 of those. I think the best way for you to know that they are credible and that they've been in business enough to know their stuff and be worth their salt is to ask them a series of questions after you tell them what's going on and see how they listen and respond to what you're sharing about your loved one. I think that's going to tell you a lot about their level of comfort with dealing with the situation, how many years and times they've done this. I mean, people call me and it's their mom, so they go into a lot of detail because this is their only mom. But this is my, 2000th call about a similar issue. So I'm really comfortable thinking of lots of creative solutions before, I even meet mom. So I think talking to different people, getting a sense of them on the phone about, I could see my mom working with him. Or, there was something about it that it just didn't seem quite right. I'm going to call this other firm. And I would say to call 2 or 3 and talk to each of them before you make your decision.
And don't you think it's appropriate to say, hey, can you give me names of maybe a couple other families that you've worked with? Do families get bothered by that, or are they okay with that?
I've had families offer to be references, and what I prefer to do is put it up as a testimonial on the website so that the families aren't having to field those phone calls, although they offer. They've been, yes, typically you can call and ask to speak to a couple, and that's a great thing to do. But, as I say, I just put them up on my website so that people can read them at their leisure, even if it's, midnight, and get a feel for how we're helping clients at Creative Counseling.
So a family that is maybe, and there's a lot of families that are, tight on dollars. If that care is starting, it could get expensive, of course. What's your experience as far as insurance or Medicare covering a portion of a care manager? I mean, cost. Is that even...
That's a really good question. Yeah. And actually we get calls all the time because people don't know what Medicare covers, not just our services, but in general for their loved one, or Social Security disability income, or veterans benefits. It's important to talk with an expert about that so that you can find out if your parent might qualify or you might qualify. Right now, geriatric care managers, elder care managers are not reimbursed by Medicare. I'm hoping in the future someday Medicare sees the wisdom in doing that, even if it's a 1 hour or 2 hour consultation to get the family on the right track. But currently, no. If somebody has a long-term care insurance policy, I've had several clients with different people. I have a woman with MetLife. Somebody was with Bankers. And what happens is they send out a nurse typically they call her a care manager typically. She comes out and sees that the person meets criteria to begin a long-term care insurance policy, which usually means they need help with 2 of what we call the ADLs, like dressing and bathing. And then they say, yeah, you meet criteria. And then they go away and you never see them again. But they're called care managers. And I'm like, well, did they help you make the follow-up doctor appointment? Did they set up your medication? Did they check your wound? It's like, no, they just came and left. And it's great because if they're certified to begin the long-term care benefits, then wonderful. You can get in-home care, or you can have money to move to assisted living or skilled, depending on what your policy covers. But there's not that hand-holding that I want to see people have as they get older. And that's not just the person on policy, that's the whole family that's dealing with anticipatory grief, anger, resentment as a caregiver, worry, lack of sleep, lack of eating well, missing their own doctor's appointments. I need somebody in there to hold that family's hand. And what I've seen is that, there's no reimbursement for that yet.
Yeah. Well, we have a couple minutes, so I'd love you to talk a little more detail about creative counseling. What I was going to say is that we can do some counseling with the families, as our name implies, and we are able to send a super bill to families to then bill Medicare. And we actually are. That is pretty successful in getting some reimbursement for those visits. That's great.
But the average care manager, I think, is not in that position. Creative counseling ends up doing a lot of, if you will, informal counseling, I think, as well, as we talk with families and move them forward on a lot of different problems. We actually do all ages, so we work with people who are 20 and have schizophrenia. We work with people who are 50 who have bipolar disorder, people with long-standing mental illnesses, personality disorders. Since Drew's background is marriage and family therapy, he actually can work with people of any age and put together a care plan and work with them over time. And we see some people once a week. We see people once a month. Sometimes we get the family moving with, 2 consultations and they're good to go. But the ability to work with all ages and do care management is really something I love about this firm.
Yeah, that's great. And
it all begins, I just want to say, with a free consultation on the phone. And anybody should know that they're welcome to call us at Creative Counseling or anywhere in the nation. All the care managers I've ever spoken to will talk with families for 20 to 30 minutes at no charge to find out what's going on for them and how we might be able to help.
And I would think, regardless where they are in the country, with technology and Skype and all of that, there could be advice given to the adult children and helping them kind of wherever they are, I would think.
Absolutely. And I've had people whom I've helped over the phone that I don't end up meeting. Or I don't end up visiting the identified quote-unquote patient. My mom's in Florida. Here's what's going on. I'll talk with the daughter locally, and then she'll be able to work with the professionals in Florida, if you will, and help her mom. So you're right. It's very easy world now to get information to people, but they have to make that first phone call and stop trying to do it themselves because this isn't what they do all day. We can't expect the adult children to come up with all those answers by themselves.
Right. So, Kira, if somebody wanted to get a hold of you or someone at Creative Counseling, how would they do that?
So you can call me at 707-762-5433. That's 707-762-5433, or you can go online to creativecounseling.org, or you can email me, Kira at creativecounseling.org, and my first name is spelled Kira. So I am happy to speak with any of the people who are listening to this podcast. Don't be afraid.
Great.
Call me.
Kira, thanks so much. It was great talking to you. I know we'll have you on again, and thanks for joining us on the Aging Boomers. And for those of you that would like to have a loved one hear this interview in its entirety, then you could certainly go to theagingboomers.com, or even you could go onto iTunes, type in The Aging Boomers. We have all the interviews and all the expertise on there. Everybody have a real safe week, and we'll talk to y'all soon.